each year, an estimated 50 to 100 million cases of dengue fever occur worldwide, mostly in tropical and subtropical areas. This includes Singapore. Singapore is vulnerable to dengue as breeding activity is high here, and as a result, there are more Aedes mosquitoes to infect people. More clean and stagnant water is available here for breeding of mosquitoes. There is also higher transmission of dengue from warmer months of June to October due to accelerated breeding of Aedes mosquitoes and shorter incubation periods. In the 2005 and 2013 dengue outbreaks, there were 14,000 reported cases and 25 deaths, and 22,318 cases and 8 deaths respectively. But what implications does dengue have on Singapore? Firstly, the daily lives of Singaporeans will be disrupted. Infected students are unable to go to school and as a result, their education is disrupted. Infected adults are unable to work and this weakens the workforce in Singapore. Tourism revenue would also decrease, as Singapore would have much less tourists here as they may be afraid to get infected with dengue. As a result, Singapore gains less revenue and would suffer an economic loss. Dengue also brings about an economic burden on Singapore as Singapore has to focus their attention on the dengue epidemic and spend money on vector control programs to control and prevent the transmission of dengue virus. The Singapore government has launched several measures. This includes public awareness campaigns. This educates the public on adopting a routine system of checks for Aedes breeding habitats within and around their homes. By eradicating mosquito breeding habitats, there would be a decrease in breeding activity of Aedes mosquitoes and Singapore would be less vulnerable to dengue. More vector control officers have also been recruited and this increases the health surveillance in neighborhoods to prevent the breeding of the mosquitoes.